3 of our course series on protocols. Last time we focused on the history of triage, what protocols were, and how the triage nurse uses them to assess her patient. We also touched on the technological advances in software platforms. This time, we will be going back to Lecture 1 and taking a more in-depth look at the first 2 steps a nurse performs when taking a triage call, the initial assessment and selecting the correct protocol. Throughout this course, keep in mind, the goal of any teletriage encounter is always to get the patient safely to the right level of care at the right time. Let's pretend we're on a road trip across country. We've set our GPS to our final destination. We put in our starting point and where we want to end up. A few choices come up, like do we want to take the interstate or the scenic route, or do we just want to go the quickest route? Once we pick how we want to get to our ending point, we will get turn-by-turn directions. Let's suppose we plugged a wrong coordinate into our GPS. We might still be able to get where we wanted to go, but it would take longer and would be more difficult. This is where it is helpful to have a general sense of where you're going and how you want to get there. Without that, it is much more difficult to navigate, even with the use of a GPS. Once you have your coordinates correctly entered into your navigation device, it will guide you step by step so you don't have to remember every single turn along the way. It is a helpful tool to assist you in getting to the right destination, and it even reroutes you if you steer slightly off course by mistake. It is the same with choosing a protocol. The protocols act as the nurse's navigation tool. She must first determine the coordinates or patient's symptoms and then plug those symptoms into her initial assessment to come up with the most accurate protocol to get her patient to the right destination or level of care. Choosing the wrong protocol may delay this care and potentially place her patient at risk for complications. While protocols are helpful to keep the nurse focused and on track, they are just one of many tools she uses. Protocols should never be a replacement for nursing judgment or critical thinking. Instead, they should enhance the nurse's skills and help her fine-tune her decision-making. Most importantly, protocols provide a standardized approach to each call, and they act as a reminder of details that could be overlooked. With our navigation analogy fresh in your mind, let's take a look at how the initial assessment information is collected. The purpose of the initial assessment is the same in any nursing job where patient care is involved. You want to get a general sense of the appropriate level of care for your patient. Always begin with your ABCs. First, assess your patient's airway, breathing, and circulation to make sure your patient is safe to continue with the triage process. After ruling out any life-threatening emergencies, the nurse will begin by asking a series of questions to elicit a brief past medical history and what symptoms the patient is experiencing now. This information will help the nurse narrow down the search for which protocol she's going to use. She should ask questions like, "Tell me what's going on tonight that had you call the nurse line," or "What has changed in your or your child's symptoms that concerns you the most?" She will want to know when the symptoms started, the severity of the symptoms, and so forth. Her questions are purposeful and are aimed at narrowing down her choice of protocols based on her patient's most severe symptoms. In other words, the symptoms that are likely to result in the highest acuity. The initial assessment, if done correctly, will give the nurse a sense of how sick the patient is and what the most appropriate symptom to triage first is. As the nurse is collecting this information, she should be mentally asking herself, is there anything in this past medical history that makes this patient high risk? Does the assessment of the airway, breathing, and circulation indicate shock, respiratory distress, or dehydration? And does anything in this story make you feel this patient is sick or in need of urgent evaluation? Let me give you an example. Meet Sarah. She's a 21-year-old female who's calling with complaints of a mild sore throat and abdominal pain that she's had since yesterday. After assuring that Sarah has no symptoms that would prompt her to activate 911, the nurse should ask questions like, which symptom is bothering you the most? Or, tell me more about your abdominal pain. When did it start? Where is it located? And how severe is it? Don't forget to ask about pertinent health history. You can say, please tell me a little more about your past medical history. Do you have any chronic health concerns? Do you take any medications, either prescribed or over the counter? Have you recently been hospitalized or had any surgeries? And do you have any allergies? Asking about her last menstrual period may also be a determining factor in Sarah's protocol and disposition choice. All of this information is an important step in the assessment process and assists the nurse to determine if the disposition will be 911, evaluate today, not urgent but may need to be seen in the next day, or the patient can safely follow up with their physician when the office is open next. Many nurses say this is one of the toughest parts of the job, knowing what to say and how to say it. Remember, patients are calling to talk to a qualified, self-assured, and confident nurse to answer their questions and relieve their concerns. They do not know what information is pertinent, so will many times tell you more information than you need. With practice and experience, it does get easier to sort through and toss out any information that is not relevant. The nurse should be proactive and ask the right questions up front. This helps control the flow of the call and keeps the initial assessment more focused and efficient. During the entire phone encounter, the nurse should be actively listening for additional clues that may help her make a decision about which protocol to enter into first. Going back to our patient, Sarah, what does her voice sound like? Is it hoarse, mumbled, or slurred? Is her breathing harsh or raspy? Is she talking very softly? Does it sound like she's moaning or groaning, or that she is or has been crying? The nurse should never assume based on what she is hearing, but should always verify by asking. Perhaps the patient always has a hoarse sounding voice, or maybe she's crying, but it's not from pain, rather she's scared or very anxious. It is important to remember that patients that are scared, anxious, frustrated, or in pain may not always tell you all of their symptoms or health conditions. It is up to the nurse to ask. Verifying and clarifying allow the nurse to be comforting, empathetic, and reassuring to her patient. Sometimes saying things like, "It sounds like you're worried. I can help." Or, "It's been a long night already, hasn't it? You must be exhausted," can go a long way in building trust and calming your patient. As you go through your initial assessment and history of present illness, ask yourself, which is the most prominent symptom? Which symptom is most likely to be harmful? Topping the list are respiratory issues, dehydration concerns, symptoms of infection, and patients with chronic illnesses. Using the ABC assessment and the caller's interpretation of their symptoms will help the nurse select the most appropriate symptom to triage first. Okay, pencils down, it's pop quiz time. How long do you think it takes an experienced triage nurse to do her initial assessment and start to formulate which protocol is the most relevant to her patient's main symptom? The answer may surprise you. It is usually only 3 to 5 minutes. Teletriage encounters tend to take an average of 10 to 12 minutes from start to finish. It's a short journey, but it's most important to stay on track the entire ride. Now that you have your coordinates, our initial assessment, and an idea of your final destination, or what protocol and disposition you might choose, it is time to follow the navigational directions of that protocol. The nurse will ask the disposition questions beginning with 911 symptoms and work her way down to the least urgent of dispositions, home care, stopping at the disposition that best matches her patient's current symptoms. The nurse must be alert and engaged during the entire call. Sometimes a single piece of information can change the direction of the entire triage. Remember Sarah? She called because she had a mild sore throat and abdominal pain. Very early in the initial assessment, the nurse should rule in or rule out the possibility of pregnancy. Depending on Sarah's response, the nurse is going to ask different questions and use an entirely different protocol. In other words, she's going to change the route and destination in her GPS. As you can tell, picking the most appropriate protocol is not always simple, but it is important. If you pick the wrong protocol, even if you use that protocol correctly by asking all disposition questions, each stop or disposition will be incorrect and you risk giving the wrong advice. This could result in your patient ending up at the wrong level of care at the wrong time. Triage nurses should never rely solely on their protocols to answer all of their questions. Experienced nurses with good critical thinking skills that correctly use a standardized set of protocols are more likely to reach their final destination quickly and efficiently, minimizing the chance of hitting roadblocks in her patient's care. Congratulations on finishing this training module on protocols, step 1 and 2, the initial assessment and selecting the correct protocol. Now, please take a few minutes to review the 3 questions to see what you've learned. Thank you. And finally, please check back soon for our next course, where we will test your newly learned knowledge by presenting scenarios and having you choose the most appropriate guideline.